the three principles of health literacy are: is the information accessible? Is it understandable? And is it actionable? And when we think about health literacy, we were able to measure and demonstrate those three areas: accessible, understandable, and actionable. What sometimes is hard or even impossible to measure is there a difference in healthcare itself? We know that we can measure just as far as getting the information into that person's hands, and hopefully they can then take the next best action with that information with their provider.
Welcome to Transforming Medical Communications, a podcast by MedComms experts. We share medical communications insights and advice from the best and brightest in the industry to find out what they're doing to push our industry forward. Here's your host, Wesley Portegies.
Welcome to Transforming Medical Communications, the podcast where we explore bold ideas shaping the future of medical affairs. So today, we're joined by J.R. Meloro. He is a seasoned executive and a medical affairs leader with extensive experience driving strategy, publications, and medical content at Pfizer. J.R. leads the charge in global medical communications and content, overseeing a variety of channels from publications and congress content to social media and field-based communications. So in this episode, we're going to unpack how J.R. is evolving medical communication strategies through data-driven insights, precision targeting, and robust metrics to measure impact across multiple channels. J.R., welcome to the show.
Thank you, Wesley. It's my pleasure to join you and your listeners. It's really good to see you and speak with you again. And very pleased to be a guest here on Transforming Medical Communications.
Likewise, thank you for being here and sharing your insights. It's really appreciated. I've been looking forward to today's episode. So maybe to start us off, and as a little bit of background, you've had quite a diverse career, right? You have quite a few different positions, from leading the medical communications function in oncology to managing publications and transparency. So I was kind of wondering, could you tell us about some kind of defining moment in your career that really shaped your views and approach to medical communications today?
Sure. Well, I would say, as you said, I've had a variety of experiences at Pfizer over the last 14 years since I joined in 2011, as well as before Pfizer, working in medical communications from various agencies, from the perspective of the publication planner and medical communications partner. But what I would say the defining moment for me was a moment that I didn't realize was the defining moment, which was working what was then a summer part-time job, which happened to be for a medical publishing company. So at the time, I was working for a division of Thomson Reuters, what's now Thomson Reuters. And at the time, Thomson had a healthcare division, and part of the healthcare offering was a medical publishing company. And so I had the opportunity to work over a summer job and then repeatedly, for the next few summers, working on the physician's desk reference, or the PDR, as well as some peer-reviewed medical journals. And little did I know that was kind of the moment or the seed that was planted for me, which eventually led me down the path of being a medical communications professional.
Wow. So there's a lot of history behind that. What was it when you were doing those summer jobs that attracted you to this industry?
Well, it's interesting because I didn't go out searching for science and medicine. Science and medicine found me. I was very curious about the publishing endeavor. I've always been attracted to communications, and so that's really my background and my training is in communications and education. I was at one point a high school English teacher, and so I brought to this career a background in storytelling. And what came and tapped me on the shoulder essentially was the marriage of storytelling with medicine and science. And so, that's the kind of the merger of those two areas is what has become my career.
Wow. That is actually really cool. And it's very rare. Like I speak with so many people and most people I speak with, they say like, okay, I was in academia, I was basically behind the bench and it became like repetitive and maybe a little bit boring, right? And then I found out about this whole area of medical communication. So they come from the science side and get to know the communication side. So you come from the communication side and got to know the science side, which is really cool. And especially things like storytelling that are now really like, I would say, a hype, right? In medical communications. It's so cool that you can bring that with you from your past. So that's amazing. Thank you for clarifying. So now you're at Pfizer. You seem to have quite a few responsibilities. Could you tell us a little bit more about your main areas of focus?
So I am currently the global team leader for medical communications and content in one of Pfizer's 4 therapeutic categories, the inflammation and immunology, as well as specialty care portfolio. And so in that grouping, we handle publications, medical to medical content, Congress content, as well as social media and third-party content. So it really runs the gamut of all of the external-facing content for healthcare professionals.
Yeah, really nice. I heard you say medical to medical. That's a phrase I don't hear very often. It's probably specific to your organization, but could you tell me a bit more about what that means?
Sure. So medical to medical in our definition is material that's developed by medical affairs for use externally with healthcare providers and other medical professionals. So typically it's material or content that's used by our field medical or our MSLs, but it can also include any interactions, whether it's an advisory board or steering committee, other sorts of professional, again, what we refer to as medical.
Yeah. So thank you. And also I noticed that there's quite a few like medical affairs or communication functions that are often separate, right? Like in the current organizations, or let me actually rephrase that. Another thing I noticed when you were outlining your focus was that I hear quite a few cross-functional areas that I very often see either different departments or different job titles for, right? Like for instance, publications and communications is often separate from things like field medical or medical content generation. Is there, so what is the rationale between or behind putting that all together?
So yes, at Pfizer, due to the nature and size of our portfolio, we have a number of different functional areas within medical affairs. Some defined by geography, such as international versus U.S., as well as functional, such as the ones you mentioned. So we have our field-based medical colleagues who are primarily in the field and interacting directly with healthcare professionals. We have medical information who are on the front lines receiving and answering inquiries from pharmacists, healthcare professionals, and the public. And then groups like mine, which are focused primarily on content creation and content generation, content dissemination. So while we are many times healthcare professionals ourselves, this is a group that's focused primarily on the art of communication and content.
I think that's really intriguing because, like you were just saying, like it's centered on communications. So instead of it being siloed, perhaps, because like a lot of companies are working to kind of connect those different silos, but what all these departments or functions share is that they need to be excellent communicators. So I think that's kind of a really cool insight to have. From previous conversations we've had together, I know that we have a shared passion about metrics and impact, right? And really understanding, okay, like if we are excellent communicators, how do we know that we actually, are making an impact together? So I know that you've been working a lot on shifting this conversation away from things like, when we look at publications, maybe the impact factor, to more article level metrics. So what led you to that decision to pursue that, and how are you measuring success when it comes to that particular area?
Sure. Well, it's an area that I'm very passionate about. My colleagues as well are very passionate about. We're in an increasingly disciplined area. We have to measure what we do, and we have to be able to understand the impact of our work. There was a time when volumetrics were enough. Let's make sure we create enough content deliverables. Let's create large slide decks. Let's generate a certain number of publications. But we've really moved beyond that. I think that type of thinking is obsolete for us. So with publications, for instance, as you mentioned, I've long been interested in article level metrics, both because impact factor is not a very good metric of measuring the value or the impact of your research, but also because we want to understand beyond the number of publications that we've disseminated. We want to understand whether there's been impact and whether there's been reach. So with the advent of certain article level metrics, we now can understand, particularly when we opt to publish in open access, we can understand the particular types of reach and the particular types of engagement and attention that our publications garner in the public domain. And so these are article level metrics that help us understand the sorts of attention we're getting in news organizations, social media, citations, as well as inclusion in clinical practice guidelines. So these are very, very important to us as we understand the sort of financial and time investment that we put into the dissemination of our research.
Yeah, absolutely. So when we look at article level metrics, can you tell a little bit more about how that differs from the other impact factor metrics, for instance, in citations?
Sure. Well, impact factor is it's an imperfect measure. It's a measure that measures the relative value or popularity, as I like to think of it, of a journal. What it does not measure anything to do with a particular paper or a particular piece of research. So I like to think of it in this way. Impact factor is like the reputation of a college or university. That's not necessarily predictive or doesn't give you any insight into the performance of a particular student. And so the article level metrics are like the grades and the score of the student, irrespective of the reputation of the university.
I like that. That's a great analogy. So now, when you use these different systems for article level metrics, how do you measure the impact that falls outside the remit of the actual journal overall, right? So for instance, we submit a publication to a journal. It is published over there. Then there's different outlets that the publisher uses to communicate that information and data. But likely you will also be communicating around this publication in other platforms like the Pfizer Pro website or these kind of things. So how do you know the impact beyond what the publisher has under their remit?
That becomes more difficult to measure for sure. We're getting then into the realm of, some anecdotal measurements. But outside of the realm of the publisher, the publisher has the ability to measure clicks, downloads, shares, citations, perhaps. But there are other parts of, other domains that are outside the realm of the publisher, like I mentioned before, social media, policy, blogs, clinical practice guidelines. So, with the particular metric that we use and subscribe to at Pfizer, we're able to get that more holistic view that's inclusive of the publisher data, but also beyond what the publisher is able to measure themselves.
That is really interesting. And I think that's where we come back to something we mentioned a little bit earlier, right? Like the communication excellence across functions. So, maybe we can switch gears a little bit and also look at some other formats and channels. So, for instance, now if we would go to a conference, right? And that is also a part of the larger ecosystem of how and where we share content. So could you tell us a little bit more about how you go about the integration of that? So communicating around publications, but then also measuring the engagement and impact potentially during conferences.
At a large medical or scientific congress or conference, that there is an experience that hopefully we're creating for the healthcare professionals and other attendees. But that experience is rooted primarily in the scientific dissemination and the presentation of data. So, we're primarily focused on the preparation of our abstract submissions with the hope that they'll be presented, have the opportunity to present those data, whether in a poster form or oral presentation or podium presentation to other professionals at that Congress. So that's our primary focus. What we're able to then do is we are able, in some instances, to measure the engagement, whether through QR codes or through monitoring in social media, the level of engagement and pickup and dissemination of those presentations at and around the Congress itself. So that's a primary measure for us in terms of the engagement with the research. We're then able to also follow some other metrics and engagement at the Congress. So at our larger national and international congresses, we'll typically have a presence on the Congress floor. We will have the opportunity to engage and to invite guests to our Congress booth, as well as other engagements that are private and semi-private types of engagements with healthcare professionals. And so, those things all together, in addition to our scientific dissemination, together are part of how we look at the engagement at conferences and congresses.
Yeah, that's a good topic. So I was talking recently with someone around like medical booths, right, at the conferences, and it's a little bit okay. Maybe this is a little bit like stereotypical, but like in the past, it was typically a small booth somewhere with like a few people from maybe MedInfo, waiting to answer questions. How can we make it more engaging, but then also how do we know there's more engagement, like more at the booth level?
Yeah, so it's a complex question and a complex topic. And so a lot of it depends on we of course have to abide by the regulatory guidance and the laws, in the country where we're conducting that Congress or conference. So we first have to abide by, the laws and regulations. And within that, there is a bifurcation within the booth of our ability to speak to our approved products and approved indications in what one might call the commercial side of a Congress booth. But then we also have the opportunity, when done appropriately, to present information that is, what we would consider to be the medical side of the booth. Typically, we have medical information, which is a function and typically a person who are able to provide answers to questions for unsolicited questions. But we also have the opportunity then to provide information when appropriate about our pipeline or about perhaps products or indications or clinical trials in areas that are not yet approved. And so, again, that's dependent on the regulations for where that Congress is taking place. But this is a real opportunity for our medical affairs colleagues to provide information and to engage with healthcare professionals in a way that is forward-looking and exciting in terms of the science.
Okay, so now we covered publications, we covered conferences. Let's look at another really important channel that I heard you mention before, which is social media. I'm seeing quite a bit of hesitation in some medical affairs teams, especially when it comes to having their own medical affairs handle, deciding which channels to start, which platforms are most attractive to their audiences. I actually recently had a really interesting recording with Kimberly Eskridge-Rose from Travere Therapeutics about this, and they decided to go with X and then to Blue Sky, for instance, while a lot of companies are gravitating towards LinkedIn first. So I was kind of wondering about your view on this and how you integrated social media into your strategy. And then, of course, again, we're going to touch upon those metrics.
Sure. Well, social media obviously is a very rich channel for dissemination and engagement. But it's one that we have to be very appropriate in terms of what we disseminate and how we disseminate it. So there are a lot of internal regulations that we have and a lot of compliance in terms of what we say and what we post. But we are currently using medical handles in social media, and we're primarily utilizing X, LinkedIn, and in some instances, YouTube for dissemination and for posts in the social space. I heard another podcast recently that was discussing the rise of Blue Sky as an alternative. It's something that we're paying attention to, but not currently. We're not currently utilizing Blue Sky. We'll continue to monitor that. But as I said, we're our efforts are primarily focused on those three channels. And in terms of metrics, it's a much more those channels lend themselves very well to metrics for engagement and impact. And so we're able to look at views, downloads, impressions very easily in that space. And so it's an area that we use to amplify when there is dissemination of research. It's a very valuable way to supplement our efforts sometimes, for instance, around an international congress.
Hey, we need your help. The best way to help us grow and reach more medical affairs professionals is to share with your community. If you love our podcast, please hit subscribe, leave us a review, and that way we can keep sharing insights from the best and brightest in the medical communications industry. Let's push our industry forward together. Something that we discussed when we spoke in the past was around the reporting for field medical, right? And as we both know, in field medical, we come really from an activity-based outcome reporting, and everyone is looking to kind of find the way forward in, more impactful metrics or more, result-oriented metrics. So could you tell us a little bit more about how you've gone about the field medical part of impact?
So our efforts in field medical and what we call our medical-to-medical materials, it's an area that I'm most interested in, actually. And that's primarily driven by the relative investment of our time and resources into our medical-to-medical materials. So whether it's from a budgetary perspective or a resource allocation perspective, we put a lot of focus and a lot of our resource deployed into the creation of medical to medical content. And so for us, I'm very, interested in the return on that investment, so to speak. So it's no longer a case where we will create encyclopedias worth of slide decks in hopes that the field may eventually need them at some point. We're more interested now in materials that are fit for purpose and materials that have a higher rate of use and reuse. So I'll break that down for a little bit. So in terms of utilization, we now have better metrics that we are developing and rolling out, where we can understand not just how many pieces we have created for the field, but we have metrics around how materials are being used. So which materials, which decks, which pieces are being used. And we now have very specific metrics on the particular components that are being used and how frequently those are being used down to the slide. So we'll have metrics that can tell us which specific slides are being used and deployed. So our usage and utilization metrics are better than they were, say, a year ago, and that's something that we're deploying as a U.S. first, but soon to be a global program for us at Pfizer. And then I mentioned reuse. So we've found over the years that so much of our efforts are duplicative, where one country creates a resource or a slide deck or a piece of content, and another country will create something very similar. That sort of duplication, is just in the environment that we're in today. We can no longer do that. So we're highly engaged and coordinated in creating parent materials and then either translating or adapting those materials into a use case for a particular country or a particular language. But we're very cognizant of creating those master sets and then reusing those whenever and wherever possible.
Yeah, that's a great point. We recently conducted our State of Medical Communications survey across the industry. And actually, this came out as, I think it was the second most important hurdle that organizations are facing, which is leveraging content locally, made so global to local, right? How to make sure that this is actually being used properly in the countries, and how do you build like an infrastructure together with your local organizations to make sure it is so, right? Because sometimes it is duplication of effort. Sometimes it is affiliates not even knowing the asset exists. Sometimes it is they feel it is not fulfilling their local needs, and then they make their own, right? There are a lot of reasons for it, but I definitely think this deserves a lot of attention because we make so much content and we just keep making more. But there are so many opportunities where we can actually utilize it better instead of making more. And I think that's definitely a good point. So maybe I missed it, but like, how do you look at like, I guess like impact there? Like, are you measuring any metrics around like how these different slide kits or other materials are being used, and how do you use that in decisions on future content?
Yeah, well, so thus far, our metrics are specific to the content. So we have a global or a universal system for deployment. So in the field, our field medical or MSLs are all using a common system for the sharing of content. And so we're able to measure which pieces are being used, when, how frequently, which components. Like I said before, we're now able to measure down to the specific slide numbers, if it's a slide deck. So we're able to measure those sorts of volumetrics. The more qualitative metrics, that's where the magic is, and that's an area that we're interested in. I can't say that that's something that we have something systematic or universal developed yet, but that is ultimately the area that we're most interested in, which is how is the dissemination and the engagement leading to impact, whether it's through a change in thinking or change in decision making or change in behavior.
Yeah. So correct me if I misunderstood, but like what I think I heard you say is like we have a unified system to deploy these decks globally, and we can see which parts of those slide decks or resources are used most, correct? Could you share like an example where the metrics on that, like where you could see that data as maybe informs a content decision?
Oh, absolutely. I think our model has been to develop for each asset or perhaps for each indication. I think the default has been in the past to develop what we call mega decks. The mega deck is the deck that has everything. It has the full gamut of discussion of disease and disease burden and the treatment landscape, MOA, efficacy, safety, the full gamut. And with the advent of some of the metrics that we're discussing, we're now able to make smarter decisions when we plan content and when we're planning what materials and resources our field colleagues and our MSLs are actually going to use based on what we have seen in terms of the patterns of use and utilization. So, there's another component to this that I neglected to mention, and that is the human metric. So one thing that I'm personally deploying is to go out into the field and not to leave it up to the metrics and the systems, but to observe and do some primary research myself, which is in the form of ride-alongs, and just to understand at the point of interaction what that utilization and what that engagement looks like, and use that as part of the feedback loop as well.
That's amazing. I think that's a great example to set, right? Because I think there are so many times where we create things in silos, right? And no judgment, but like there are people that create assets to be used here that have never been in a doctor's office, right? And I think it's always really, really hard to do that if you don't know the exact setting. So I applaud that approach. I think that's great. And I think we should give as an industry as many people as possible the opportunity to actually see how our work is being used in real life and how it impacts and affects people, because it would just dramatically increase, I think, the impact of what we do, because you can only really understand when you observe. So that's definitely great.
Yeah, if you use the analogy of our team being in the kitchen making the meal, it sometimes is quite valuable to come out of the kitchen and to see how the.
Yeah, absolutely. So, and I was also wondering, like, if you have these metrics on the use of slides, have you been able to make a decision to cut a part out of any of these decks? They're like, well, we made that, but it's actually never being shown, or is that too extreme?
I can't say that we've encountered that scenario just yet, but it's certainly on the table.
Yeah. So now we've discussed like quite a few different approaches and areas where we communicate to the outside world. We spoke about metrics for each of those as well. Now, how do we put it all together, right? So you're managing several channels. They all have their own kind of intricacies and their own set of metrics. I think it would be really interesting to see this kind of in some kind of unified way, so we understand the total impact. How do you go about that?
Yeah, so that's the that's kind of the art and the science of the storytelling, right? So, it's a matter of collecting the right data in many times in a dashboard format, and I think that's that's the scientific approach. But I do think that there's an art to it as well. When I worked previously in oncology, that was an area that I came to understand fairly well in terms of engagement and impact. And having moved now into different therapeutic areas, there very much is a different nuance and a different context in a rare disease, for instance, where impact is measured and can be measured in a vastly different way. How a clinical trial is conducted, the number of patients, how the data are presented, it's just a very different environment and can be a very different environment. And so that's why I say that there's an art and a science to it, because we have some trials where we have thousands of patients, and we have other trials where we might have 10 patients. And so the way that impact is thought about and measured and contextualized internally and externally just can be very, very different. And it's something that we can't just focus strictly on numbers. We have to consider the relative impact within that therapeutic space.
I really like that, because I do think that as an industry, we're a little bit at risk of overanalyzing the metrics data, right? And maybe not just overanalyzing, but maybe also just go by the numbers only. And like you said, the context to those numbers can be vastly different based on, other things that we can't put into dashboards that easily. And knowing that most of the people working in this particular sector are coming from, the academic roots, right, where it's all about the data, I think that's definitely something we need to advocate for. And like you just mentioned, going on the ride-alongs is a fantastic example, I think, on how we can support the context of the data, right? So it's like the heart and the brain, or the gut and the brain, for that matter. We need both.
I had a mentor, someone who was very influential in my career at Pfizer, who was our chief medical officer. And our chief medical officer had been a clinician earlier in her career. And she often told a story that really resonated and has stayed with me. And that was about an early interaction she had with a patient where, as a clinician, she was explaining a particular therapeutic approach and the benefits and the risks of that particular therapy. And she was very dutifully explaining in what percentage of patients a particular adverse event might happen. And this might happen 5% of the time, and something else might occur 2% of the time. And the patient stopped her and said, "But if it happens to me, it's happening 100% of the time." And so that anecdote has always stuck with me as a reminder that we can't focus solely on statistics and measure things in that way. We also have to think of it relative to the patient and to the patient's family as well.
Yeah, absolutely. JR, I'm wondering, how do you look at the future of this, right? Like when we talk specifically about metrics, imagine we're 5 or 10 years ahead, right? Fast forward. How does the world look like?
How does the world look like? Well, so many questions about how things will develop. But I'm hopeful that things will look very similar to the way they do today, but just much more efficient. I would imagine that our decision making, in terms of the things that how the decisions that we're making about the dissemination of our data will be smarter, will be more efficient, based on our ways of working, based on the deployment of artificial intelligence to help us analyze, summarize, synthesize information more easily, and that the metrics that we've been talking about will help us to make better, more targeted decisions with our data and with our content.
Someone is listening to this podcast and they're inspired and they think, yeah, I want to step up on metrics and measuring the impact of our work here. And let's say there's not much in place to do so currently. What would you say are 3 things they should be focusing on first?
Well, I think one thing that I would start with is what's your budget? Because I think budget is something that we haven't talked about, but is very much an important component of the decision matrix. I think number 2 is going to be is thinking about impact in terms of impact to whom. So many times we do things that are that can be self-referential, that can be measuring value from our own frame. But I would invite our listeners to think about the impact for the patient, for the participant, for the for the person receiving the care, for the healthcare professional who's receiving the information. So think about the recipient would be the second thing that I would recommend. And then I think the third thing is the so what. So we can measure many things in terms of our activities, but what insight is that going to deliver, and will it give us an opportunity to make a change or to do something different with that information? So I think that's probably the most important thing, is what sort of insight will that information provide, and will that give us an opportunity to adjust or change our activities or to think of it in a new way?
Yeah, amazing. So I have a follow-up question for the budget part here. Would you say that better metrics will result in a good ROI when it comes to spend on content? In other words, do you feel that if you have the right metrics, you can actually save more money than that it costs to get the metrics in place?
Yeah, I think better metrics can help you save money, or better metrics at least can help you use the budget that you have more wisely and may free up funding for additional activities. So, being able to measure and demonstrate ROI will allow you to redeploy some of your resources. And ultimately, I think, can make a difference to the organization as well as to the healthcare professional and their patient.
There's a lot of things we do that we don't have to do, and that would not make a difference on the impact. And then there's things that we should do and that we don't do, but we often lack the budget, probably because we spend it in the wrong place, that would actually make an impact, right? So I think that's the most intriguing about the whole metrics situation, is that I think it should really inform action. So it's nice to report and, tell leadership and anyone internally or anyone that wants to hear it for that matter. It's like, hey, listen, this is the impact we made, and it is a positive impact, right? But I like it even more if we can say, hey, we're going to develop this resource, and this is why, like, our analytics show us that there's a need for this, and this is what we expect to happen when we do, right? As in more positive impact. And I think we have been sailing blind for a long time in that regard, where in other areas, in other industry, other verticals, including the commercial side of pharma, they have already had that under control for some time. And I think we have a harder time getting there because everything needs to be non-economic, obviously, which makes total sense to me. But it just makes it a little bit hard because you can't just look at the bottom line and say, does this make sense? Like financially, it's different things that we need to measure here.
In a slightly tangential area, I'm very interested in health literacy. And the three principles of health literacy is the information that's being provided. The fundamentals is the information accessible? Is it understandable? And is it actionable? And when we think about health literacy, we're able to measure and demonstrate those three areas: accessible, understandable, and actionable. What sometimes is hard or even impossible to measure is there a difference in healthcare itself? We know that, and we can measure just as far as getting the information into that person's hands, and hopefully they can then take the next best action with that information with their provider. We would love to be able to demonstrate that there's a difference and an improvement in healthcare and in their outcomes. We're not able to always draw a straight line between information and outcomes, however. So it's something that's a little bit more difficult to measure, but it's something that we aspire to.
At least we know that if someone does not have the information, they cannot use it for their decision making, right? So I think that is always a very reassuring factor.
That's right.
I really enjoyed our conversation. Thank you for sharing all these beautiful insights and shining a light on how we can look more into how we can show the results of our work and understand how we can further optimize that. This was really insightful. Thank you so much, JR. It was a pleasure to have you here.
Wesley, thank you. Thanks for having me. It's a pleasure, as always, to speak with you.
Transforming Medical Communications is brought to you by MedComms Experts. To find out more about MedComms Experts and how we create some of the most cutting-edge medical communications programs anywhere in the world, visit www.medcoms-experts.com. And then make sure to search for Transforming Medical Communications in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at MedComms Experts, thanks for listening.